Hi Diane.
Hello.
Hi. I'm Ross, and you brought me a little budgie by the name of Casper. I could have guessed that, I guess. And Casper is showing obvious signs of respiratory disease. The first thing that I'll get you to tell me the story at the moment, if you're happy to do that. What I'm seeing just at a glance, and we may focus on this, is the tail bobbing, or the tail arching, Casper's tail arching over a wide arc. So his breathing is quite laboured. Casper is a male. He's got a mauve cere. Most people, or many people who do not know budgiegars, think a pink cere means, or pink or mauve cere means a female budgie, but it means a lutino or an albino, as in his case, or a pied or harlequin budgie, male. So if they're not one of those, they usually have a blue cere, and the females usually have a brown cere, but they sometimes have a creamy coloured cere, and they sometimes have a bluey coloured cere, but usually with some cream in it if they've got a hormonal imbalance or they're very, very young. Anyway, this little fella is definitely a male by the colour of his cere and his appearance. He's making some respiratory squeaks. He is doing some coughing and gagging. He's scratching at his mouth and throat as if he's got a sore throat, showing discomfort there. He wants to clear something there. And he has also, a little earlier, within a couple of minutes of arriving here, he started shutting both eyes. So he knows he's under observation at the moment, so he's on guard, but he's obviously a delightful little budgie, but he says, I really would like to blow my nose or do something if I could. Yet his nostrils are not blocked from the outside, and he hasn't at the moment got obvious staining of the feathers above the cere. So I see bird, and his eyes aren't glugged together or any of those signs. So he's showing distinct symptoms, but not the full spectrum of symptoms that we often see with many cases of respiratory disease. His droppings look like little bullseyes, and the white part of his droppings is looking pretty white, almost snowy white, and he doesn't appear to have diarrhea, so that is good. One of the major causes of respiratory disease, which is chlamydia, very often, but not always, is accompanied by green or yellow in the white part of the droppings, often a bit more urine around the droppings, so wetter droppings, and semi-formed or tacky dark part of the droppings, intestinal part. However, he doesn't have to have those signs to have chlamydia, or what we sometimes call psittacosis if it affects us.